Good afternoon, everyone. Thank you for joining us. On today's briefing, we'll hear from Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, and Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. Mayor Barrett, I'll hand it over to you to get us started today. I believe he was, oh, yep, he's with us.
Preparing for today and thinking about this being vaccination week, if you will. I started thinking about back when I was in my 20s and 30s and thinking how I took great pride in the fact that for many, many years, I actually didn't go to the doctor. I thought, well, I'm young, I'm invincible, I don't have to go to the doctor. I'm not going to go to the doctor. I don't need to go to the doctor. Don't make me go to the doctor. And of course, things change as you get older. And I mention that because it's World Immunization Week. And we're at a time right now, I think, in our country's history, and certainly in our state's history and in our city's history, where the question we face is, do we get the shot? And so I want to speak directly to the 20-year-olds, the 30-year-olds, and now the people younger than 20, that you might be Superman, you might be Superwoman, you might be invincible. Many, many years ago, I felt the same way, but I recognize now just how important it is, not just for yourself, but for your parents, for your grandparents, for those people who you love in your life, to do what you can to protect them. And if you look at the curve of this disease, obviously it took a huge, huge upswing back November through January, and then started actually a little later than that, started coming down, and now we've seen a little increase again. And so we know we're not out of the woods at all. And so here during World Immunization Week, I really want to stress how important it is for everyone to get the shot. I just think that that's something that we all benefit from. And I hope that people can take advantage of that, and people do what's right of all ages, because it is important. And I think that we do have to do it. Vaccines are recognized as the world's most successful intervention and prevent 2 to 3 million deaths each year. They reduce the risk of disease by working with your body's natural defenses to build protection. So when you get a vaccine, your immune system responds. We now have vaccines to prevent more than 20 life-threatening diseases, helping people of all ages live longer, healthier lives. So they can help protect us against dangerous and debilitating vaccine preventable diseases like diphtheria, tetanus, influenza, measles, and now COVID-19 as well. So again, please get the vaccine. It brings us closer to people, and we are trying to get it in the community as much as we can. And I'm going to talk about that just for a moment, because the city continues to offer quick, easy, and free vaccinations for Milwaukee residents at the Wisconsin Center and at the Northwest and Southside Health Centers. As of April 22nd, the vaccination rate for Milwaukee adults who have completed their vaccine is 26.4%. We can do better than that, and we have to do better than that if we are going to beat this disease. I want to continue to see that number grow. So in addition to the sites that I mentioned, we're continuing our efforts in the community to bring the vaccine to the people. And our efforts for this week include today, where Pastor Fred at Jackson Park Lutheran Church, located at 4535 West Oklahoma Avenue on the south side, offered vaccinations to the public from 9 a.m. to noon. Also today, Reverend Roy Hopgood Jr. of Mount Horeb Missionary Baptist Church, located at 5350 West Center, will be offering vaccinations from 1 to 4. Tomorrow, April 28th, Ascension All Saints Family Health Center, located at 2400 West Villard, will be offering vaccinations from 1 to 5. And finally, on Thursday, Pastor Mary Martha Canas of Hepatha Lutheran Church, located at 1720 West Locust, will be offering vaccinations from noon to 4. So I think you can see that we take a comprehensive view of this, and we ask you to take a look at other places where you can take the vaccine. So a lot's going on, but we just have to beat this disease, and working together, I'm confident that we will. So with that, I'm going to turn it over to Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers, we're currently seeing an average of 133 new cases a day and about 1 death each day. We are seeing subtle improving trends with respect to our case numbers and positivity rate, though a slight uptick in our overall hospitalizations. So put together a fairly steady picture with our disease burden in Milwaukee County. I wanted to talk for a minute today about the global burden of COVID that we are seeing and how that ultimately affects us locally. So worldwide, there are now more daily COVID cases than at any other point in the pandemic. In that sense, worldwide, the pandemic is currently worse than it's ever been. So that's over 800,000 new cases per day. We hear a lot about India, which is having a disastrous and tragic increase in cases, as well as a stretching of resources. We hear less about the dramatic increases in cases in Brazil, as well as Turkey, Germany, Colombia, Argentina, and many other countries. And in each of these countries, cases are rising sharply and contributing to an overwhelming number of hospitalizations, as well as many, many deaths. But as is often the case with tragedies around the world, it's easy to feel that these situations are removed from our daily lives. Now, on a human level, we must remember that these are humanitarian disasters. In India, hospitals are out of space, and those people that do make it to the hospital often find that hospital is out of oxygen. Now, severe illness with COVID most frequently affects the lungs. And as the lungs get infected and inflamed, they fill with fluid. And that fluid makes it very difficult to breathe. Oxygen can help by maximizing the effect of the portions of the lungs that are functioning. But without that oxygen, these patients will not be able to breathe. They will, in a sense, drown in their own reactive fluids in their lungs. And that's what's happening to many, many people in India. Many of the people watching this broadcast have family in India or in one of the many countries around the world struggling with COVID outbreaks. And I can only imagine how difficult that must be. But for many others watching this, you don't know anyone in India or Brazil or Turkey or Germany. But what we do know, what we have learned over and over in the last year and several months is that none of us live in isolation. We didn't live in isolation when the virus began in China. We didn't live in isolation when cases began to take off in Washington State and then New York not so long ago. And we certainly did not live in isolation when dangerous variants, mutations in the virus that lead to increased contagiousness, increased severity, and even immune system evasion, when that developed in places like the UK, like Brazil and South Africa. Each time that the virus replicates and moves from one person to another, mutations occur. And while most of these mutations don't make much difference at all, we see that in places where the disease burden is high, where cases are out of control and spread is out of control, more mutations naturally occur. And it's more likely that one of those mutations will give the virus an evolutionary advantage. And that virus will then be able to take hold and multiply. And an advantage to the virus ends up being bad news for all of us. So if you feel disconnected with the people of India, you cannot feel disconnected with the burden of disease and the likelihood that enormous outbreaks like this lead to dangerous variants. And this is why the vaccines are so important, not only for you, but for your neighbors, for your community, and for the world. Not only to limit individual disease, but to limit these outbreaks that create variants. At the moment, we're lucky that the vaccines available seem to work very well against these variants. Now, people in India, in Brazil, Turkey, Colombia, Argentina, they are desperate for the vaccine. Here, we are privileged to have an abundance of vaccine supply of 3 different types of vaccines. We're also cautiously optimistic to have a relatively low burden of disease at the moment. But again, we don't live in isolation. The best way to protect yourself, but also to protect your children, your parents, your coworkers, your neighbors, is to get vaccinated. So certainly, please keep the people of India and around the world in your thoughts, but take advantage of the vaccine supply that we are so lucky to have in our community. Visit healthymke.com to find a location near you to receive the vaccine if you haven't already done so. Thank you and stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. As Mayor Barrett mentioned, this is World Immunization Week, backed by the World Health Organization and aimed to promote the use of vaccinations to protect people of all ages. This year's theme is Vaccines Bring Us Closer Together. And we know the way forward to visiting with our loved ones outside of our own homes is through vaccination. We want to celebrate this week by encouraging all Milwaukee residents to get vaccinated. And as Dr. Weston mentioned, take advantage of the vaccine supply we are fortunate enough to have. If you have questions about the vaccine, you can visit milwaukee.gov/COVIDvax or Healthy MKE for more information. Lately, there have been national stories about people failing to return to receive their second dose. And we cannot emphasize enough how important it is to receive both doses to be considered fully vaccinated. At the Milwaukee Health Department vaccination clinics, you schedule your second dose on site after receiving your first dose. At other vaccination sites across the city, you may also register for your second dose or need to follow up to schedule. For Pfizer, the CDC recommends 3 weeks before receiving your second dose, and for Moderna, it's 4 weeks. The Milwaukee Health Department has started calling individuals who have not returned for their second dose to schedule if they are interested. The Wisconsin Center is still operating as a mass vaccination site through May 28th, when it will wrap up as planned. This week, the hours of operation will be changed just slightly. The site still opens at 9 a.m., but will close a half an hour earlier. Monday through Friday, we'll be closing at 5:30, and on the weekends, we'll be closing at 3:30. In addition, this Sunday, May 2nd, is the final Sunday that the Wisconsin Center will be open for vaccinations. As part of our ongoing efforts to bring vaccine to the community, the Milwaukee Health Department has been providing at-home vaccination appointments primarily for homebound residents. To date, we've supported 160 vaccinations in partnership with Bread of Healing. If you or someone you know can benefit from this service, you can call the Milwaukee Health Department COVID-19 hotline at 414-286-6800 to schedule an appointment. The Johnson & Johnson vaccine is officially back in circulation. The Wisconsin DHS supports this decision. Starting tomorrow, the Milwaukee Health Department will provide the option to receive this vaccine at our mobile vaccination sites and shelters, but we will always have Pfizer available for those who choose not to receive J&J. This afternoon, the CDC announced fully vaccinated Americans can go without masks when walking, jogging, or biking outdoors, or while dining with friends at outdoor restaurants, but still recommends everyone wear a mask in more crowded settings outside, such as sporting events or festivals. At this time, the Milwaukee Health Department has not updated our mask ordinance, but we are looking into it and having internal conversations, but we'll continue to follow the CDC guidance. Thank you.
Thank you, Commissioner. Our first question is from Tom Durian with TMJ4. He asks, can the mayor or commissioner speak to the collaboration with the Bucks for vaccines at Sunday's game? How did this come about?
Sure, I can speak to it. And as I did misspeak last Thursday, I thought the game was last Thursday. It was actually this Sunday. This came about because we were in discussions with the Bucks and the Brewers and other work sites, identifying their seasonal workers who may be interested in being vaccinated. And it's part of our effort to sort of meet people where they are. And in this case, it started as a meet individuals or employees where they are. So we started thinking about their employees specifically, and then it evolved into having a vaccine available for people who are attending the game.
Thank you, Commissioner. Our next question is from Rose Schmidt with CBS 58. She asks, the question is for Dr. Weston. Nationally, experts are predicting that within a month, everyone who wants a vaccine will have been able to get one, and the focus will shift to trying to build confidence for people who are still hesitant. Have we hit the so-called wall of hesitancy?
I don't think we've hit a wall of hesitancy. I think we've just shifted phases in our vaccine strategy. I think we've gotten beyond the people who are either eager or readily able to get vaccine. And so now I think we're seeing that strategy shift already. We're seeing it with increased walk-in centers. We're seeing it with increased mobile sites, increased pop-up sites, increased events across the county where vaccine comes to people in times and places that are convenient, as opposed to asking everybody to come to us. And so I think we're seeing that shift. I don't think we've hit a wall of hesitancy, but I think we're starting to shift that so that it's easier for people who may have questions about the vaccine or may have limitations, transportation, childcare, job-related limitations to get the vaccine.
All right, the next question is from Hillary Mintz with WISN 12. She asks, what, if anything, will the new CDC outdoor mask guidelines change in Milwaukee? What are you recommending for our outdoor festivals this summer and beer gardens with mask requirements?
So as I mentioned, we are looking at our current masking ordinance because there is a part of the ordinance that speaks to if you're outside and within 6 feet of people from outside of your family, you should be masked. So we are looking at potentially editing that piece, but again, it's going to take a little bit of time. However, our guidance specific to outdoor festivals and beer gardens, any place where you would be gathering with individuals who are outside of your family or who you may or may not know their vaccine history, we will be recommending and requiring masks.
Thank you, Commissioner. The next question is from Ashley Sears with Fox 6. Perhaps Commissioner and Dr. Weston, you can address this. Along the same lines as Hillary, will there be any changes to the Milwaukee County Zoo mask policy and at Brewers games?
So with regard to the zoo, very similar answer to Commissioner Johnson. The CDC guidelines are fresh and brand new, so we'll certainly review them and consider them when making guidelines for the zoo.
And similarly for the Brewers, the guidelines actually very specifically state outside events like festivals or sporting events should still maintain masking requirements. So the Brewers will continue to have a masking requirement.
All right. The next question is from Allison Durr with the Milwaukee Journal Sentinel. I'm not sure if there's anything to add here, but with the new CDC guidance regarding wearing masks outdoors, how likely is the city of Milwaukee to adjust the outdoor portion of its mask guidance? And would Mayor Barrett support lifting the outdoor requirement?
Well, we'll continue to work with the health department, and our goal, and I think what we've accomplished in the last 14 months or 13 and a half months, is to follow the science all the time. And so I'll be working with the commissioner. I'll be working with interested members of the Common Council to see how we can make sure that we are in full compliance with both the letter and the spirit of the CDC guidelines.
Thank you, Mayor Barrett. Allison's next question is, have the city and county begun administering the Johnson & Johnson shot again? If not, when is that expected to happen?
So we are planning to administer it starting tomorrow.
All right. Our next question is from Madeline Anderson at Fox 6. She has a few questions for Dr. Weston and Commissioner Johnson, and they are related to the CDC's new mask guidelines. The first is this the right move given the variants are still spreading, or should restrictions be loosened further? Do you think these changes will incentivize more people to get the vaccine?
So I can start here. I think they are good guidelines. I think what we've learned and continue to learn about the vaccine is that they're extremely effective and extremely safe. On the effectiveness front, I think good news keeps coming. It seems that in real life, not in the trials of tens of thousands of people, but when we give it to 75+ million people in the United States that have received the vaccine, it's extremely effective. In many cases, it's even more effective than the 94-95% that was predicted. And so with that increased effectiveness combined with the fact that disease spread seems extremely low in outdoor environments, I think it's a reasonable step, and I think it's a reasonable incentive to show people that vaccines are the path back to normalcy. And this is one small step to get back to normal.
The follow-up question is just, given the new guidelines, she'd like to have a reminder of what the local mask ordinance is.
Currently, the outdoor portion of the city of Milwaukee's mask ordinance is anyone who is within 6 feet of anyone else outside, vaccinated or unvaccinated, because at the time it was written, the vaccine wasn't available, is required to wear a mask.
Thank you. The next question is from Mayan Silver with WUWM. She asks, Will the city or county be having any sort of campaign to ease any concerns about the Johnson & Johnson vaccine? And will you still be using it for vulnerable populations like the homeless or those who move frequently? What sort of education campaigns will there be or options for these groups?
So I can start. So I think there'll certainly be a lot of discussion, a lot of messaging on what happened with Johnson & Johnson, what the review was, what the side effect is, and how common and how serious that side effect is. I think what it comes down to, we can start the messaging right now. I think what it comes down to is that this side effect, this type of blood clot, in the beginning was rare, and it was different from other blood clots. It required different treatments than a typical blood clot. That education is out there. Every doctor in the emergency department now knows what to look for and how to treat these blood clots in order for people to be as safe as possible should they happen. But the fact remains that these blood clots are occurring in 1 to 2 people out of 1 million that are receiving the vaccine. And when we think about the relative risk, you can open up your medicine cabinet and probably everything in there has a greater risk of serious side effects than this vaccine. And so you have to really weigh the risks and benefits and understand the risks of COVID as well.
I don't have much to add other than the other piece that the ACIP came out with was to assure that women who are over the age of 50, or I'm sorry, under the age of 50 are just aware of this rare side effect that could occur.
Thank you both. The next question is from Rose Schmidt with CBS 58. She asks, how important will local vaccine clinics like those at churches be as the city shifts away from relying on the Wisconsin Center site?
I think they will continue to be very important. They've been important to our strategy since the beginning. And as we shift away from the Wisconsin Center, we are still going to have 2 sites operating, both at the Northwest and our South Side clinics. That will be standing. So there's a place where people can always go. There's also many other locations on Healthy MKE's website. But again, I really think it's imperative that we're getting out into the community and meeting people where they are. And that's been part of our strategy since the beginning.
And I can tell you from my perspective, I absolutely love these partnerships with churches, with community groups, with others. And as long as we have willing partners who will produce arms for us, I want to keep doing this because I think it is one of the most, if not right now, the most effective way, one of the most, if not the most effective way to get people the vaccination.
The next several questions are from Sari Lesk with the Milwaukee Business Journal. I believe the first few are for Commissioner Johnson. Sari's asking, what is your timeline for potentially changing the city's mask ordinance? And what percentage of people who got their first dose from the city health department have not returned for the second?
So our timeline for changing the ordinance, I think internally we hope to have a conversation by the end of the day today with some, we'll just coalesce around what the ideas around the change. And just, it's going to take a little bit of time to get through the process. So hopefully by the end of next week. And then the percentage of people who've gotten their first dose from us and have not received their second is pretty much in line with the federal or the national data, which is between 5 and 8%.
The next question, either Commissioner Johnson or Dr. Weston, I believe you could answer it. We've heard for a few weeks now that we're in a new phase of vaccinating as opposed to hitting a wall of hesitancy. How well would you say the community is making progress with people who are open to it, but have not made an appointment?
Yeah, I think we see continued progress. We're still seeing about 8,000 people being vaccinated per day, 8,000 new individuals being vaccinated per day in Milwaukee County. We're up to 40% as of today. 40% of the county has received 1 or more doses of the vaccine. So I think we are continuing to make progress. We still see a high number. 8,000 people a day is a high number. I hope we can keep it that high, but we'll continue to watch the trends and we'll continue to adjust our strategies to meet people where they are with the vaccine and try to get the vaccine into as many arms as possible.
And the final question is for Commissioner Johnson. The final question from Sari Lesk, based on current vaccination trends taken together with the city's current gating metrics, for how long do you plan to keep the city in phase 6?
So it's really based on our data. I'm happy to say that 41% of City of Milwaukee residents have received their first vaccine, so that it's exciting. We're getting there. So we just want to encourage more people to get vaccinated. But our metrics are starting to improve slightly, as Dr. Weston mentioned. We have begun to see a slight decline in the total number of cases and a decline in our positivity rate, which is promising, although it just started in the last 4 to 5 days. So we're going to hold until that changes.
And what I'm seeing as the final questions are from Mayanne Silver with WUWM. I believe they're for Commissioner Johnson. Is Milwaukee unique in its willingness to set up, oh, actually, sorry, Dr. Weston, you could also answer this perhaps, but is Milwaukee unique in its willingness to set up vaccine clinics in business, sports, games, ferries, or is this a new phase that we're seeing around the country? Where did the health department come up with these ideas to go where the people are? And she's referencing, have any other cities or states influenced Milwaukee's approach?
So I think we've had these conversations since before I started actually in my role. I mean, I actually think I mentioned it during my confirmation hearing. So, January-ish. This is taking vaccine to where people are is a strategy that's been used across the world. If you think about world vaccine strategies and thinking about developing countries and how to get vaccine into marginalized populations or populations that are harder to reach or don't have access or transportation. And I think it's really just, it was, again, an idea that's been for all of us working on vaccine distribution, thinking about, again, those populations that we have in Milwaukee who it's just harder. They have childcare or transportation or multiple bus lines. We want to make it as convenient as possible for everyone. And so again, I think it's just, we thought pretty critically about how can we do this. And when FEMA came, it really gave us the opportunity to alleviate some of the work we had at the Wisconsin Center and transition that into the community and getting out there. So I'm proud of the work we've done. But it's really based on sort of what we've learned in public health and population health and also from global vaccine strategies.
I would agree. I think Milwaukee has been very progressive in moving to the next phase before the first phase is over. And so we certainly saw a drop off in the number of people coming to the mass sites, to the Wisconsin Center, to Kazi Community Center, places like that. But before that drop off occurred, there were plans already in place, and it was already starting to have walk-in sites, to have community-based sites, to have sites at churches and at community centers, and going out to where the people are to give vaccines. So I think we've tried to stay a step ahead. I think the health departments, Milwaukee Health Department in particular, I think the health departments have done a good job of doing that. So I think that's unique to Milwaukee County. We've seen a lot of other parts of the country going to people as well and following those public health principles. I think two other things that have been unique to the county and to the health departments. One has been the transparency of data and of plans, having briefings like this to talk about exactly what we're doing, exactly what we're planning, where we're going to be, what the next steps are, and what the thinking is. And then also, I think the targeted approach with the EVE model, with targeting zip codes, and now with continued targeting of messaging, of resources, of vaccination to high vulnerability communities, and in particular, high vulnerability communities that are not receiving as much vaccine.
We have a few clarifying questions. The first one comes from Allison Durr with Milwaukee Journal-Sentinel. She's asking, is there a hope that changes to the mask mandate could be taken up for immediate adoption at the Common Council's May 4th meeting, or would it wait until the next cycle?
I will answer that. Of course, President Biden and CDC just made this announcement probably in the last 2 or 3 hours. So we literally are going to be powwowing later today with my office, with the commissioner. Her health department staff is already starting to look at it. And the next step, of course, is to go to the interested alders who have been involved in this issue. When we first instituted the mask ordinance, you may or may not recall, we deliberately went through the ordinance. I mean, we went through the council. And the reason we went through the council with an ordinance is because we knew that there were legal challenges that were occurring statewide for those mask mandates that were promulgated in essence by a health commissioner or someone else. we felt that it would be safer from an attack if we went through the Common Council, which is exactly why, working very closely with the health commissioner, with the city attorney's office, with the members of the Common Council, I think we've been able to withstand any legal attacks on our mask ordinance. Moving forward, we will continue that. It worked very, very well. And I have respect for the legislative process. So again, what I would say is, as soon as we know what the process will be, we will let you know. But I cannot say with this news, basically 2 hours old, that we have made a decision how we're going to move forward. But again, we're going to work with our partners at the Common Council and with the health department to effectuate our goals.
And I'll ask Siri last question just in case there's anything else to add. She's wondering, would this have to move through the committee structure, or could the council amend the ordinance without getting a committee's recommendation?
Again, a lot of those procedural questions are going to fall within the bailiwick of the Common Council itself. I think the first step is for us to decide what the best path forward is, and then we'll figure out the best process to move it through the Common Council.
Excellent. Those are all the questions for today's briefing. Thank you all for joining us, and we will see you on Thursday.
Thank you all.
Thank you.
Take care.